Hello, my name is Michael. I'm one of the co-founders at SPECT. Here at SPECT, we've created the first platform for eye care screening. I call the stethoscope for the eye. It's this product right here. Basically, we are trying to enable anyone in the medical community, whether it's a nurse, a medical assistant, your family doctor, paramedics, or EMTs, to be able to look at your eye and to really do that first level of screening. So how does the product work? Well, it's very easy. Your nurse or medical assistant will just pick the device up. This is the device itself right here. As you can see, it's very small, it's lightweight, it's an iPhone. It has some optics and some electronics in the back. There's a light that will come out of the back. And then they'll be able to basically take this and shine it towards the patient's eye and capture the images. So when they pick it up, they'll be able to go in, enter the patient's name and information. So we're looking for their name, their date of birth, and at which point you will connect to one of our experts on the other side. So we call them the navigators. At which point the navigator will guide the user on how to capture those images. Let's teach them how to hold the device, how to point it towards the eye, tell them move in a little bit closer, move in further, move left, move right, and capture the images. So over here you can see an example of the image that has been captured. This is one of our healthy patients, and so you can see as it goes in, we're able to do these guidances and teach the user on how to adjust their positioning and their angle to capture the images. So over here we can also see this is a different patient. This patient is abnormal. As you can see, there's a little bit of scarring up here on the top. So this patient actually was not even aware that they had laser scarring in the past, and that with the SPECT device we were able to identify this. And this is actually really important to know because we'll actually want to follow this patient and track them as it progresses over time. So this is another example, and so you can see in this patient, I don't know how clearly you can see them, but there's a little bit of spots, and so there's a little bit of hemorrhaging, so those are little red spots. And the convoluted spots are the yellow deposits, those are fatty deposits. And so again, these are small things that don't affect your vision immediately, but if left untreated, will start to affect your vision. And so this is the stage where we do want to catch these diseases while they're still asymptomatic to the patient. But that's really when we want to start treating them and monitoring them to prevent it from progressing to a later stage where the patient could lose their vision in the future. So we're really excited about our partnership with HouseMD because we'll be able to bring this technology to their home and test people more often, right? Today, testing is only happening in optometry and ophthalmology, which is a big problem, whereas we have a lot more primary care doctors and nurses where we can do this wherever the patient is. We call this eye care anywhere.